Medical scientists come up with new ways that healthcare professionals can treat and care for patients. A major change in how some surgeries are performed deals with robotics. Sydney Canty spoke with a surgeon at Mercy Health as a local hospital celebrates a huge milestone in robotic surgeries.
Thanks, Derek. Well, St. Elizabeth Boardman uses the Da Vinci surgical system for some of its procedures. And two of its surgeons have each completed more than 1,000 robotic surgery cases. Yes, you heard that right. One of them, Dr. Marie Awad-Alexander, is sharing what this accomplishment means and how these procedures are working for them. So thank you so much for joining me, Doctor.
Thanks for having me.
First of all, congratulations. This is very cutting edge. But for the viewers who might not know, can you briefly walk us through what the Da Vinci robot is and what exactly it allows you to do?
Yeah, so the Da Vinci robots, it's actually been around quite a while. It started off with more urologists and gynecologists operating in the pelvis, and then has branched out, and now general surgeons like me have really started using it quite a bit over the last decade or so. But basically, we've done laparoscopy since the early 90s, and the robot enhances laparoscopic surgery. And basically, cases that might have been difficult to do laparoscopically are made much easier by using the robot. The robot has arms that I can control all of the arms. The instruments have wrists on them as opposed to like straight sticks that we used to use for laparoscopy. So it really revolutionized laparoscopic surgery, which ultimately is better for patients because it's small incisions as opposed to doing big incisions. So a lot less pain after surgery, fewer complications, shorter length of stay, quicker recovery.
And minimally invasive is what it sounds like. This is really, futuristic. Talk to me about why it's a better system to use for some surgeries and what types of surgeries do you use it for? Is it just the one that you named or are there others as well?
Oh, so many surgeries. In general surgery, all of the surgeries I used to do laparoscopically, I now do on the robot. So gallbladder surgery, colon surgery, I do a lot of colon resections, again, especially in the pelvis where it's a very tight area and tough to do open sometimes. I mean, I don't do adrenal surgeries, but you can do adrenal surgeries on the robot, any like duodenal operations, small bowel operations. I do stomach operations on the robot. Hernias, I do a lot of hernias. And hernias, we've noticed a really big improvement with pain after surgery, especially inguinal hernias or groin hernias. A lot of people have, and typically we used to do those open with an incision that was a few inches long. And now we could do it with 3 tiny incisions, 8 millimeters, and most people don't even need pain medicine after surgery. That's how almost painless it is.
Oh my goodness! Wow, really making strides here, in the medical, field. Talk to me about how long you've been versed in this type of technology. I would imagine maybe it took some time to get used to, or was it easy?
Yeah. Honestly, learning the robot, there's always a learning curve with anything, but robotic surgery, especially when you're going from straight laparoscopic surgery to robotic surgery, it's not too difficult to make that leap. And honestly, it's a lot more like open surgery than it is even laparoscopic surgery. And we all train in both of those during our training. But when I trained, I finished in 2012 with my training, and a lot of what I did was open. There was some laparoscopy, but advanced laparoscopy, most people did fellowships for that. This makes it very easy to do advanced laparoscopy robotically. And I've been doing it since 2016, so almost a decade now I've been doing it. And like I said, I've transferred most of my practice over to minimally invasive robotic assisted laparoscopy.
And just in these last few seconds that we have here, was there ever any indication that surgery would evolve in this way, or does it still seem like science fiction becomes reality at times? I mean, this is like a movie.
Yeah, this is just great for patients more than anything. I think it's fun because I love what I do and I love the robot. It's a really kind of fun tool to use. But honestly, sometimes it is beyond our imagination, the things that are out there and the things that we can do. But the robot is evolving. The biggest thing right now is that they're trying to get us the haptics, meaning so we can kind of feel how hard we're pushing. And we're doing that from a robot in the corner of the room, which is kind of crazy, honestly.
Wow, and unlike anything I have ever heard of. Dr. Marie Awad-Alexander, thank you for joining us to talk about this today. We so appreciate you. Looking forward to see what else this could evolve into, you know?
Thanks again.